Gerald E. Markle and Frances B. McCrea delve into a thought-provoking question, which also happens to be the title of their book. What if medicine disappeared? Imagine waking up one day and finding out that all doctors, hospitals, and pills just disappeared. What would happen to our health, our society, and our lives? This isn't just a flight of fancy, it's a deep dive into a world without Western medicine. What if medicine disappeared? It's a question that stops you in your tracks. What would the world look like without primary care physicians, surgeons, psychiatrists, and all the medical specialties we take for granted? Let's start with the economic impact. Medicine is a massive part of our economy, accounting for about 15% of the US GDP. That's over $1 trillion a year. We have around 800,000 physicians, 1.5 million registered nurses, and 200,000 pharmacists. In total, more than 4 million people work in healthcare. If medicine vanished, the ripple effects would be enormous. But here's the kicker. McCrea suggests that if medicine disappeared, it wouldn't have much impact on illness and death. Probably nothing would happen, she says with an enigmatic smile. Maybe some here and there. Now, before you dismiss that as crazy talk, consider this. In 1999, there were about 2 million serious adverse reactions to correctly prescribed drugs in hospitals, leading to an estimated 106,000 deaths. That's the 5th leading cause of death in the United States. And let's not forget about nosocomial infections, which afflict about 6% of all hospital admissions, causing 88,000 deaths annually. That's the 6th leading cause of death, ahead of diabetes. And there's more. Medical errors kill between 44,000 and 88,000 people per year, and unnecessary surgeries? Well, in 1974, the US House of Representatives estimated that there were 2.4 million unnecessary operations, resulting in 16,000 deaths. When you add it all up, these medicine-induced problems account for about 250,000 deaths per year, roughly 11% of all deaths. That's a staggering figure. But what about the placebo effect? The authors delved into this fascinating topic and discovered that placebos can be incredibly powerful. In fact, some studies show that placebos can be almost as effective as real drugs. This led them to explore alternative medicine, which is used by more than 4 in 10 Americans. The estimated expenditures for alternative medicine services in 1997 were $21 billion, with at least $12.2 billion paid out of pocket. Markle and McCrea also considered public health, which operates on a different scale than individual medicine. Public health focuses on the whole population, while medicine typically treats one patient at a time. This fundamental difference led them to question the very nature of the medical model, which is based on 6 key assumptions. First, health is defined as the absence of disease. Second, disease is defined by symptoms and signs. Third, there is a clear dichotomy between the mind and the body. Fourth, disease states are independent from the body and cannot be caused by behavioral or cultural factors. Fifth, the body is viewed as a machine, with each part treated separately. And lastly, medicine is a science, unaffected by moral or subjective judgments. The authors then turned their attention to primary care physicians, who are the gatekeepers of the medical system. But what do they actually do? The average office visit lasts only 19 minutes, and during that time, patients do little talking. In fact, physicians interrupt their patients after an average of only 22 seconds. The most common reason for a visit is a complete physical examination, but does it really make a difference? The evidence is mixed, at best. What about routine screening? The authors found that while screening can detect diseases, it doesn't necessarily lead to better outcomes. For example, mammograms and PSA tests often produce false positives, leading to unnecessary anxiety and invasive procedures. And when it comes to cancer, the evidence for screening is often inconclusive. For instance, the mortality rate from breast cancer has remained stable from 1930 to the present, despite all the screening and treatment. Next, Markle and McCrea explored the world of surgery. They discovered that many surgeries, like caesarean sections and hysterectomies, are often unnecessary. In fact, some estimates suggest that up to 2/3 of all caesareans are needless. And when it comes to cardiac surgeries, like stenting and bypass grafts, the evidence for their effectiveness is surprisingly weak. Studies have shown that these procedures often don't prolong life or prevent heart attacks. Even more startling, the authors found that sham surgery can be just as effective as real surgery. This calls into question the necessity of many surgical procedures, if a fake surgery can produce the same results as a real one. What does that say about the power of the placebo effect in surgery? Finally, the duo looked at emergency medicine, which is perhaps the most critical aspect of healthcare. Emergency departments are the safety net for the uninsured and disadvantaged, but they are also overwhelmed and underfunded. Despite these challenges, emergency medicine does save lives, particularly through the chain of survival, which includes quick access to care, CPR, defibrillation, and advanced care. So, what did they learn from this thought experiment? Medicine is a complex, flawed, and sometimes contradictory institution. While it undoubtedly saves lives, it also causes harm. The medical model, with its focus on treating disease rather than promoting health, may be fundamentally flawed. Perhaps it's time to rethink our approach to healthcare and consider a more holistic, integrated model that incorporates the best of both traditional and alternative medicine. In the end, the question, what if medicine disappeared, is not just about imagining a world without doctors and hospitals. It's about questioning the very foundations of our healthcare system and exploring new ways to improve our health and well-being. As we continue to grapple with the challenges of modern medicine, we must remain open to new ideas and possibilities. After all, the future of healthcare depends on our willingness to imagine a better way forward. This has been a BrightLearn video from BrightLearn.ai on the book What If Medicine Disappeared? By Gerald E. Markle and Frances B. McCrea. Visit BrightLearn.ai for more fascinating videos like this one, and visit naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.